Good afternoon, everyone, and thank you for joining us for our September 15th, 2019 technical update. The Minister of Health is joined today by Dr. Wesley Miller of the Bermuda Hospital's board. Minister, you may proceed with your remarks. Thank you.
Thank you, and good afternoon, everyone. I begin my remarks today by offering sincere condolences to those who recently have lost a family member, a friend, a neighbor, or a colleague in circumstances related to the coronavirus. And as I ask everyone to keep those persons in our prayers currently in hospital also who are suffering from COVID-19 related illnesses. The Ministry of Health received 2,949 test results since the last update, and 150 were positive for COVID-19. This gives us a test positivity rate of 5.1%. As the number of active cases increases significantly, primarily through community transmission, the government must take proactive measures from a public health perspective to prevent further cases. We must put measures in place to slow the transmission of the highly contagious Delta variant. This afternoon, I am announcing the following changes to the current public health emergency powers regulations, and these changes will take effect from Friday, September 17th. And the update of the changes are as follows. To protect against future rises in hospital admissions, a curfew will be instituted from 12:30 a.m. until 5 o'clock a.m. daily for the next 2 weeks. While the essential services will be exempt, as they and others have been exempt during previous curfews, the expectation during this nighttime curfew is that the general public will be in their homes. Due to the transmissibility and the severity of the Delta variant, the large group sizes will be reduced from 50 to 20 for the next 4 weeks. The mitigating change is a preventative measure to assist in evading the spread. To minimize the risk of spread in our hospitality settings, restaurants, bars, nightclubs, and sports or members clubs, they will all now be required to limit tables to no more than 10 customers and to space these tables 6 feet apart. Bar service will continue to be permitted, but you must be seated, no standing at the bar. The legislation will be amended to include powers for the police to close a premise where they are non-compliant with public health directions. Additionally, no raft-ups will be allowed for any boats, whether recreational or commercial. Wearing face masks indoors continues to be required and must be worn in crowded outdoor settings as well, where 6 feet physical distancing cannot be maintained. To further reduce the rate of spread and the mixing of households, we urge anyone who can work from home to do so. There are many businesses in Bermuda that can manage their workloads and workflows from home, and they should be doing this. Work environments are a major source of our transmission. Let me repeat, this includes driving in the same car or truck to get to a work site. Your colleagues are not part of your personal household bubble. If you must go to work, do not mix and mingle with your coworkers without wearing a mask. Sharing a lunch or break room without adequate protection has also led to outbreaks. This happened in December and in April, and it's happening again now. When will we ever learn? I will now turn my attention to the enforcement of the public health regulations. The Ministry of Health's team of compliance officers is working closely with the Bermuda Police Service and the Department of Public Prosecutions to progress cases that involve non-compliance with public health directions. Since June, we have prepared 6 case files for the police and prosecutions, and there are 4 more in progress now. Also, the police are fully prepared and ready to issue fixed penalty tickets for breaches such as leaving a place of isolation or quarantine. I would like to remind people who must isolate or quarantine to take it seriously. Because of the high volume of positive cases, the Ministry of Health's Epidemiology and Surveillance Unit cannot contact everyone who has been identified as having a risk of exposure. If you are informed that you are a close contact of a positive case, quarantine for 14 days and then get tested to ensure that you are not still infected, because the virus can incubate for up to 2 weeks. Bermuda, we understand the economic and emotional strain this pandemic and further restrictions is having, but this outbreak is spreading quickly in our community. in closed settings with mixed households, people not following the guidance, getting out and about in our community with symptoms, and not adequately using personal protective equipment. These restrictions are necessary to protect our community. They are not designed to make people's lives harder, and we must strike a balance between protecting the island and protecting our economy. I urge everyone to please be patient for the next couple of weeks, be extra vigilant, and follow the regulations and guidelines. Whether you are vaccinated or unvaccinated, everyone in our community has an individual personal responsibility to help stop the spread of the coronavirus. If we do not follow public health guidelines and safety measures, our community spread will continue, hospitalizations will increase, and sadly, we will see more COVID-related deaths. Again, avoid closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings like close-range conversations. Wash your hands with soap and water frequently and use hand sanitizer when hand washing facilities are not available. 6 feet must be maintained at all times, including during gatherings, unless you are wearing a mask. And as I have said, since January of this year, your best protection is the vaccination. Time is running out. 1 dose of the vaccine will be of help for people who are not vaccinated at all. However, the best protection comes after 2 doses of the vaccine, 2 weeks after the second dose, to be precise. The challenge is that the Delta variant is so easily transmissible, and it is so widespread now that the longer you wait to make a decision about vaccinations, the more likely it is that you will be exposed to the disease and will be unable to fight it. We have about 230 first doses remaining until our next vaccine shipment arrives. The United Kingdom has consistently supplied our vaccine needs, and the Bermuda Advisory Committee on Immunizations is meeting this week to make recommendations about boosters for those who are already fully vaccinated. Details around booster shots will be communicated in the future. At this time, there's no need for persons who may wish to get a booster shot to register for the vaccine. Finally, I'm extremely concerned about this outbreak's impact on our healthcare system, as we all should be. Every part of our healthcare system is affected. It is overwhelmed, and our healthcare workers are working tirelessly on long shifts under tremendous pressures. They are to be commended, and we must be all grateful for everyone on the front line and those behind the scenes working to manage this fast spreading outbreak. I am joined this evening by Dr. Wesley Miller from the Bermuda Hospitals Board, who is also prepared to answer any questions related to the COVID pandemic. Thank you.
Dr. Miller?
Hello.
Hello, Dr. Miller. You need to turn your camera on, please. Thank you.
Wonderful. Thank you very much. I certainly welcome the actions taken and the help that we have received from the public and the ministry. And certainly this announcement of the new regulations can only serve to the benefit of the entire community. The rapid rise in hospitalization has been a concern, and certainly with a reduction in movement of people, we will begin to see a slowing down of that curve, and eventually we will begin to see a decrease. But we're not out of the woods, and even at this stage, it is important to observe the public health measures of frequent hand washing, wearing a mask whenever the separation is less than 6 feet outside, and certainly wearing a mask in indoor meetings, and certainly not thinking that, okay, I'm young, I'm fit, and nothing will happen. At BHB, we have had to make a number of changes rapidly as we recognize that with this disease, the more severe cases end up going to intensive care, and others will be admitted to the ward, but they have to be admitted under special conditions of isolation. So we had to create negative pressure rooms. It involved then also the use of appropriate PPE. A number of procedures have to be adopted in order to minimize risk to patients as well as staff. At the present time, for instance, we have the regular ICU, intensive care unit is full. We created a satellite unit which also is at capacity, but fortunately, we also created and have up and ready to go a second satellite, and therefore we have contingencies in place should things get worse. We've also said in the past that we've had enough respirators, we have enough ventilators, and therefore our challenge is not so much in terms of equipment. Our challenge is really with staffing, because since COVID is in the community and our folks live in the community, as the COVID rises in the community, some staff will get ill and therefore they're not available to work. Others will have exposures and have to be on quarantine. And currently we're seeing that situation playing out. We also expect and we see that the other things still keep happening. So people still get strokes, they will still have heart attacks and other serious conditions that will require intensive care treatment. At the present time, COVID has dominated everything, but we remain ready and we're open to deal with other conditions. So I would say to people who have serious illness, don't stay away. We're here willing to treat you, and we make provisions for that. The impact on staffing has been mainly on nursing and having enough nurses to look after these patients. So when you go to the intensive care unit, for instance, one ill patient will need 2 nurses per day at a minimum, and that doesn't account for any breaks at all. So you imagine if we have 3 more or 4 more, 3 patients will demand 6 nurses per day, and then you have to add in somebody to relieve and somebody to deal with illness. So it begins to be a strain on the staff. At present, they have been very good, and several will work double shifts, but they can only do that for so long. The impact, although I mentioned nursing, is also on all the other staff, the biomed teams that have to make sure that our equipment is up and serviced and ready, the domestic staff that make sure that we have clean facilities, because without appropriate cleaning, the hospital wouldn't function, and we certainly couldn't manage infection. And I must say a public thank you to those staff from housekeeping and laundry and the dietary. They have done a wonderful job. Similarly, every time we open a new area, we also place more demand on IT, and they have been very responsive to that demand. The front of the hospital is always the emergency department, and the staff there, the ambulance staff, the nurses, the doctors, and their clerical people have all risen to the challenge. However, there are times when they reach near breaking point because we have challenges in moving people out of the emergency department to the main wards. Added to all our challenge, we do have patients who would be better cared for elsewhere, and we take the opportunity to appeal to the relatives to take them home, because in so doing, they would be helping others who are badly in need of hospital admission. In that respect, the Ministry of Health and the Social Services have been quite responsive to our needs. The care homes have in the past. Unfortunately, COVID is everywhere, and they too have their challenges with patients who are not so well as staffing challenges, which we see not just now in healthcare, but in some other areas as well. The important thing I would emphasize is that for people within the community, as well as for our staff who are not yet vaccinated, is to make sure they sign up and have their vaccines. At BHB, the doctors are over 90%. The nurses are now at 70%. But unfortunately, some of the others within the organization have lagged behind significantly. The opportunities are there for them, just like the rest of the community, and we'd certainly like to encourage everyone to go out and have their vaccines. And in fact, we can say with certainty that even among our staff, the people who are COVID positive, at least 80% of them have not been vaccinated. So the vaccine does help in that respect. Also, in terms of the people who have severe illness, it's much, much less likely, even when you have underlying conditions, to get severe illness from COVID if you're vaccinated. So the message is go out and have your vaccines. Happy to take any questions.
Thank you. Thank you, Dr. Miller. Thank you, Minister of Health. I'm now going to welcome the media to ask questions, and we will start with the World Gazette. Jonathan is here from the Gazette. Jonathan?
Yes, ma'am. Okay. Am I set up, folks?
You're fine, Jonathan. We can see you. Thank you.
Okay, I'll get right into it. Appreciate everyone for having this as always. Dr. Miller, welcome back. I wanted to start with yourself. We've been hearing a great deal about how the burden is on the hospital and its manpower. And you've mentioned that there's a lag in staff there getting vaccinated. Obviously, the government's message has been that they're leaving it to the discretion of individual people. Given the gravity of the situation, are you thinking of, I don't want to say compelling staff, but mandating it in some fashion or giving more of a push to get them fully vaccinated?
That's a very good question, Jonathan. And I can see in many quarters there is frustration as to the fact that we don't have 100% or closer to 100% vaccination. Unfortunately, the challenge is that we're not in a position to mandate that because our legislative system is different. Some companies have taken it upon themselves in the United States to do that. There were others in the UK who wished to do that. In fact, one hospital in London announced it one afternoon and they reversed the policy by the next morning. And my suspicion was that they recognized that they were not in a position to enforce that.
Thanks. I guess one for yourself, Minister. I mean, so we're hearing of these restrictions now. We did hear a while ago that it looked like we saw this coming. We were headed into a fourth wave. Is this too little, too late? I'm hoping you can speak to that. Obviously, the decisions are made based on medical advice and a whole host of factors. But I know people will be asking that. I was hoping you could tell us about that.
Sure. Thank you, Jonathan. I think it's important to note when you're dealing with COVID, you're dealing in real time. Things are always evolving. And as recently as Friday, the Premier announced during his ministerial statement the importance of persons adopting personal responsibility. We have had COVID for 18 months, and we will unfortunately move into 2022 with COVID and beyond. So we are trying to encourage persons to exercise a degree of personal responsibility. Take personal responsibility for yourself and the community as it relates to ensuring that you're maintaining physical distancing, ensuring the hand hygiene, ensuring the 3 C's are adhered to, mask wearing, etc. Unfortunately, because of what we're seeing with respect to this community transmission, people aren't necessarily adhering to that message of being responsible for themselves and exactly, and in extension to others. So that's why we unfortunately are forced to have these type of restrictions on people's movements, because people aren't doing it themselves. We know that everybody is fatigued, and it's unfortunate, but if persons would just adopt personal responsibility for themselves and their behavior, then we would probably have not seen the degree of rise of the Delta variant, albeit as transmissible as it is, if persons would have adhered to the simple basics of hand hygiene, wearing their masks, and practicing physical distancing.
Thanks, Minister. The third one that I had, I guess, would be for yourself as well. In terms of a next shipment of the vaccine, you mentioned the UK is always willing. Do we know when, the amount, what type of vaccine? Are there details you can give us on our next shipment?
Actually, Jonathan, we don't have that information yet, but what I can say, as has been the case previously, the United Kingdom has assured us, as well as all the OTCs, that they will supply sufficient vaccine for the population to meet the demands of the population. So we are absolutely certain that that promise that's been extended to all the OTs will be honored for Bermuda in particular.
Got it. I believe I'm on question 4. I think that would be for yourself as well, Minister. We've heard for a while that there's a committee looking at the booster shot.
Right.
When is the decision? Do we know when they're going to come out with a decision on it?
Well, you would have heard the UK only made an announcement with respect to the booster just a couple of days ago.
Yeah,
as I indicated in my statement, locally, the immunization team will be meeting this week to discuss further steps with respect to the booster, how it will be distributed to whom, et cetera. And as soon as that information has been finalized, then we will, of course, relay that to members of the public. But they are meeting again this week.
Righto. And I believe this is my last one. I suspect it would be for yourself as well, Minister. We are hearing of, let's say, impact to government services, prison, trash collection, bus drivers. Can you speak to the level of impact that this outbreak is having on the various government services? I don't necessarily need to single anyone out, but it looks like something's going on there. We'd be grateful to tell us about it.
When you're dealing with community transmission, as is the case here in Bermuda, with almost 1,000 active cases, and a number of persons that are obviously close contacts, so those 2 are in quarantine, then naturally it will, because we all live in the community, so it will naturally impact not only government services, but private entity services as well. So again, we are dealing with community transmission, so it's not surprising that private and public entities and businesses would be adversely affected.
I believe that's it for me.
Thank you very much, Jonathan Bell. Thank you. We'll now go to Don Burgess, who is reporting from the broadcast. Thank you, Don.
Persons that are obviously close contacts of those 2 are in quarantine.
Hello, Don. Go ahead. You're live.
All right, thank you. Health Minister, regardless of the government's decision on boosters, can local health providers and doctors bring in COVID shots and provide them to patients independently from the government's program?
Don, do you mind repeating that because it was a little bit of a delay, so I think I missed the first part of your question.
Oh, okay, thank you. Yeah, regardless of government's decision on boosters, can local health providers and local doctors bring in COVID shots and provide them to their patients independently from government's program?
Well, you would note that the vaccine supply comes to the government through the United Kingdom. There are still requirements, as we've spoken about before, insofar as the cold chain, and most of the private physicians don't have the adequate freezing that is required for the storage of the vaccines. However, notwithstanding that, when the decisions are made with respect to the boosters, and you would have heard the CMO a couple weeks ago when a similar question was asked, he said these are real-time decisions. The committee will be meeting again this week. They meet regularly to discuss all issues as it relates to vaccination and immunization, and the issue about the boosters is probably number one on the list. The United Kingdom only made a decision 2 days ago, so I'm anticipating that more decisions will be made and finalized, and information will be provided to members of the media and members of the public in very short order.
Okay, thank you. I got in a little delayed, so you may have said this at the beginning. You and the government have put the onus on the public to take personal responsibility for suppressing the current outbreak, but there are some things over which only government has control: the availability of testing, the COVID hotline. We've had multiple complaints of people not being able to get in because of the overwhelming numbers, obviously, right now, and resources allocated to MDL. All these are problematic. What is the government doing to fix these key problems?
Well, I wouldn't necessarily agree with you in saying these are matters that are problematic. Unfortunately, when we see rises in cases and surges, then we see more people that are interested in being tested. Several weeks ago, prior to this particular outbreak or this wave, nobody was getting a test. So, people do seem to be more interested in getting tested when we see a surge in an outbreak as we're witnessing now. There's no secret that we are, the lab facilities are, overwhelmed right now. The whole healthcare system is overwhelmed because of the amount of persons that are having positive cases, and then, of course, the persons that are close contacts, which is why we did announce, particularly for Bull's Head, that we are not having walk-ins right now. Bull's Head is just reserved for persons that are close contacts and or cases. You would know a number of businesses I've spoken about, schools and other institutions that have been impacted adversely. We are continuing to community as best as possible with respect to availability of testing. PROTS, as you would appreciate, is still only reserved as a traveler clinic, but we are looking at other mechanisms with respect to, particularly, for example, persons that want the safe key and or are requiring testing for outbound testing to be utilizing some of the private labs. So we're bringing them on board as well so that they can assist with dealing with the demands that we're seeing.
Okay. I know you talked about the personal responsibility for people. Given the recent surge and long wait times to get tested, can local health companies and local businesses bring in rapid antigen tests for schools, bars, restaurants to use on their students and customers? We understand that Bermuda Customs has blocked the importation of rapid tests in the past. Why is this, and when they're being successfully used in other countries?
Well, I can't comment about what you've just spoken about concerning customs because I have no direct knowledge about that. But as we've spoken about previously with respect to antigen testing and the like, as the CMO has indicated, there is a testing committee and they meet regularly to determine the efficacy of different types of tests that are on the market, and not all things are created equal. We do have a small supply of antigen testing locally, and one of the discussions that the testing committee is having as it speak is how to utilize that effectively and whether and in what circumstances, such as perhaps circumstances where it could be used for outbound testing for persons such as going to the United States that an antigen test is an acceptable mechanism. So those protocols, as well as the use of the antigen test, are discussions that are being had. But again, it's important to note that not all tests are created equal, and the efficacy is not necessarily as high in certain of the tests.
Okay, thank you. We're getting reports that the international triathlon and golf events scheduled for October, and I think it's first part of November, is under threat with the current conditions that Bermuda is facing. Can you give us a update as to whether or not they will be going on, or is that under a watch situation?
Those questions would be better suited for the BGA. I don't have any direct knowledge about that.
Okay, and then my fifth question for Dr. Miller. Bermuda Broadcasting understands doctors and staff in certain departments at the hospital have been ordered to go to work before they get their test results back, even if they have been exposed to COVID. Before, this was a mandatory quarantine for 2 weeks. Is this correct?
Not quite correct. What has happened is that if we have vaccinated staff who have been deemed exposed, depending on the nature and the duration of the exposure and the area that that staff work with, they may have the option of returning on what is called a mobile quarantine. But for all of those staff, they wouldn't be returning until they have at least had a negative test and we know the result.
Okay, so yeah, appreciate you clearing that up, because I actually had a couple of messages today from people saying that they've been ordered back to work after they'd taken their test and they didn't have their test result back.
Yeah, what happened is that the test result would have to be available to EHS, the Employee Health Services, and then and only then, if they meet certain criteria, would they be back at work on a mobile quarantine.
Okay, thank you. Okay,
John,
go ahead. Sorry.
Hi, that's okay. Don and Jonathan, if I can just add something, because I literally just got further communications from the Director of Public Prosecutions a few minutes ago before we went on air, and that's with respect to the status of prosecutions from the 1st of August. You would recall, Don and Jonathan, in the Premier's address ministerial statement on Friday, he indicated that the police were going to be empowered to have further to be able to take further action in addition to issuing the fixed penalty regime, which you're familiar with, but also so that they can also have the power in circumstances where businesses and premises and liquor license establishments are not adhering to the public health regulations, the power to close those establishments for 24 hours. In addition to that, according to the DPP, as of the 1st of August, and I'm just going through the numbers really quickly, 2 matters have been fixed for trial, 1 matter has fixed for mentioning, 3 matters are awaiting first appearances in court, 7 matters are awaiting a court date, and 4 matters have been finalized. So there have been a substantial amount of prosecutions as recently, and as well as files being prepared for prosecution for breaches as recently as from the 1st of August. And again, as indicated by the Premier, the regs will be amended to provide the police further powers to close establishments for up to 24 hours for their failure to adhere to the public health regulations. Thank you, John. I didn't mean to interrupt, but I just wanted that information out.
No worries. Well, I appreciate the update. I think like one of the things for the public is there's an outcry as to what's happening with these cases. So maybe they can be updated at least once a week so that the public can know where they are in the process. And as I know, the court system doesn't move as fast as we'd like it to sometimes. So I think the public appreciate that.
Okay. Well, a famous jurist once said that the wheels of justice move slowly, but they move nevertheless. So okay. I will update the public as quickly as I am made aware of the cases that are pending, as well as the level of prosecutions. But thank you.
Thanks, Don. Don, we have a few more minutes. If you have a couple more questions, I invite you to ask them now.
Okay, great. Dr. Miller, between the ICU and the first satellite, how many people are in them?
COVID patients?
Yes.
Well, we had 11 earlier on today. By the time I was coming on, it's 12. So we have 12 ICU COVID patients. Now that's the time I'm coming on. even while I'm speaking to you, that number could change because if one improve enough, we send that one to the ward. On the other, if one or two on the ward were to deteriorate beyond a certain point where we couldn't safely maintain them on the ward, we would have to transfer them to the ICU.
Okay, thank you. And then also, you mentioned there's a number of staff members who are affected. Can you give us a rough number and percentage of how many staff are affected?
We had, in terms of staff confirmed COVID positive, it was 21 staff confirmed COVID positive, and of those 21, 17 were unvaccinated.
Okay, and how many other staff are affected because of the exposure?
Well, we have a few more staff who would be off on quarantine, but overall our numbers are relatively low because this time by having the vaccine, unlike previous when we definitely have to put them off for 14 days, because we have the vaccine, if they have a negative test, and depending on which areas they work in, not applicable to every area, but depending on which areas they work in, we can have them back with full PPE under what is called a mobile quarantine, so they can work in full PPE. They're not allowed to eat in the same area as other staff, and when they finish their shift, they go straight home.
Okay. And I don't know if Jonathan has another question, but
Thank you, Don. Thank you. Yeah, thanks. I'm just going to invite the World Vet to ask their final question. Thank you very much, Don. We appreciate having you here today. Jonathan, we just welcome you to have a couple of final questions before we end.
Sure thing. Can you hear me?
Yes, we can hear you.
Yes.
Good questions, Don, by the way. All right. Minister, one thing that I get asked to ask quite a lot of the time, you recall, I believe it was around the time of the springtime outbreak, but I think there have been other cases where folks have been seen out and about and they've been connected with or believed to be connected with outbreaks, and people ask why these people don't end up before the courts. I've always figured, but never actually asked, that you can't prove who caused an outbreak, or is it a case of these people can't be tracked down even though they're seen on social media or videos, that type of thing? I wondered if you could tell us a bit about that, because as I say, I get it a lot.
Right. At this point, Jonathan, when you're in community transmission, by nature, by virtue of the definition of community transmission, it effectively means that there's far too many cases for you to be able to identify or link to a particular index case and or to travel. So in these circumstances, it would be very, very difficult for us to be able to indicate who's walking down the street and if they're positive, whether they're the case or their contact, et cetera, because of community transmission. But what we can say is that in light of the relatively recent legislation with respect to the fixed penalties and the fact that the police have the power to issue tickets for breaches of quarantine, leaving your isolation, et cetera, and it's an automatic fixed penalty, that in conjunction with the new compliance officers that we have retained for the Ministry of Health, one of them happens to be a former police officer. So he's working in tandem with the Bermuda Police Service as well as DPP to ensure that persons that violate our public health regulations and our emergency powers orders are brought before the court. And you would have seen the illustration of that when I just read some 20 cases since the 1st of August, and the level of prosecutions, files being prepared, trial dates being fixed, court appearances, and so forth. So we are taking this extremely seriously. And as the Premier indicated on Friday, we will be amending the legislation so that the police will have powers to close a premise and or a liquor license establishment for up to 24 hours for any breaches of our COVID violations, our COVID regulations. And it's unfortunate that we have to get to that, but that's the reality of the situation. If people aren't prepared to exercise a little bit of personal responsibility, then we'll have to come down with a heavy hand of the law, which we have no reluctance to do so.
Got it. The last one from me, let me recall it. So in Friday's House of Assembly, I believe you said lockdown couldn't be ruled out. I know you don't like the term lockdown, but I wanted to ask what number or what would be the trigger for making a drastic move like it's shelter in place. Lockdown is what we call it. But I was hoping you could elaborate on that. I believe your term was that it couldn't be ruled out.
I don't recall saying that, but in any event, there are other measures such as what we're seeing today that we are hopeful will prove the proper balance that we're trying to strike with respect to keeping our economy running, but also trying to minimize the impact of the further spread and transmissibility of the Delta variant. Nobody wants to go back and return to a shelter in place, certainly from an economic perspective, because not only, from a public health perspective, poverty is obviously an issue from a public health perspective. So we certainly don't want to see ourselves returning to that particular position. And our hope and our prayer and our desire is that this particular short, sharp shock that we're implementing now with respect to these rollbacks will cause people to stand up and pay attention and recognize, hang on a minute, I have personal responsibility in this. I have skin in the game too, and I need to adhere to the public health guidelines so that we are not all adversely impacted. And if you don't mind for a moment, Jonathan, I'd like to invite Dr. Miller to provide a little bit more commentary concerning the false narrative that people that are vaccinated are the ones that are transmitting the disease. Dr. Miller?
Yes, thank you for that opportunity, Minister. Nothing could be further from the truth, because the people who are vaccinated, they serve as protection for themselves, but also protection for the relatives and others around them, in the sense that the vaccinated individual is less likely to be infected. And if that person is infected, the duration lasts for a shorter period of time, and that individual is also less likely to pass it on to somebody else. So the spread really is from the unvaccinated people, and they are the ones who not only suffer personally from it, but also create great suffering for their loved ones and their workmates and others around them. So I certainly would like to emphasize that the vaccine or the vaccinated person is not the way to spread the disease, is the way to contain and to eliminate it. And in fact, had more people taken up the vaccine earlier when it was available, we would have seen more people partying now rather than having to be running scared because the COVID-19 is so rampant in the community. And if they see yesterday's numbers and today's numbers, they will realize we're in a different place. In fact, to put it in perspective, the highest number of COVID-19 we've had in ICU on the previous spikes was 9. Right at this moment, we're at 12. And it's really, again, we're seeing this serious illness in those who are not vaccinated.
Got it. Thank you.
Thank you, Jonathan. Before we end, Minister Dr. Miller, would you like to say anything before we end the conference?
Thank you, honey. I just want to end by thanking the members of the media for their questions and for airing this. But if I could just remind members of the public 2 things. One is that it is incredibly important for us all to be to adhere to the public health guidelines. I mean, we are our brother's keepers, and we all have a personal responsibility to our families, our friends, our loved ones, and our overall community. And the only way that we're going to get through this is if we work together with respect to adhering to what the public health guidelines are saying concerning mask wearing, hand hygiene, following the 3 C's, and maintaining physical distancing. And also, if I could just add, just on behalf of the contact tracers who, like other segments of our health community, are working tirelessly to try to address and arrest this particular spread so viciously going throughout our community, is if you're contacted by them to please be cooperative. they're only doing their job. And it doesn't make sense for persons to be hostile and cagey about the information. You know, we do require this information, obviously, so that we can help to contain the spread. And likewise, those members of the call center that are working extremely hard. You know, we're just asking for persons to just exercise common courtesy to the members of the health community who are working and away from their own families to help us to stave off this continuation of the spread. So that's pretty much my parting message: personal responsibility and cooperation. Thank you, honey.
You're welcome. Dr. Miller, would you like to have a parting message as well?
Sure. I certainly thank you all for the opportunity, and thanks for the press for coming, and thanks to the public who have been observing the public health regulations and have been exercising caution, and would urge others that it is not too late. Get the vaccine. Also, there's a misconception that now that we have a few newer modalities of treatment, it will make the vaccine not necessary. So, for instance, there is talk about the monoclonal antibodies. Now, these are relatively new. Funny enough, the people who say they don't want to take the vaccine because it is experimental fail to realize that these new medications do not have full approval either, because they are so new. Essentially, they have been fast-tracked. So if the vaccine was experimental, these things are even more so. So it shows how illogical people can be at times. But suffice it to say, on the present showing and the recommendation, whereas these monoclonal antibodies will have some usefulness, they cannot be used to treat patients in the intensive care, for instance. In this very ill patient, there is no role for these medications. They will, in some instances, if given to the right group of patients, prevent them ending up in hospital. But you have to treat a lot of patients to see results in a few. So it's not an alternative to the vaccine. And also another misconception, because people will read these things on social media and elsewhere, the monoclonal antibodies, they're not preventative. So you can't take that and say, okay, I go to this place and have an infusion, and that is going to prevent me getting COVID, because they're in no way preventative. So again, we're looking at them because we take a broad mind and an open mind, and we look at everything, and we're prepared to get them as soon as it becomes available to us. But, and this is important, it is not a preventer of serious infection. And for those with mild infection, only a few of those who take it will see benefit. So the answer is get your vaccines, pay attention to hand hygiene, wear the mask in indoor spaces and outdoors whenever close to individuals, exercise care and caution at all times. Thank you very much.
Thank you. Thank you, Minister Wilson. Thank you, Dr. Miller. Thank you to the media, and thank you also to our sign language interpreters. That ends our press